We wanted to do what we're calling AppeTEDs, and these are little appetizer TED Talks. By TED Talks, we just mean they're little talks, and it's not to tell you the whole story, it's just to give you a bite to whet your appetite about different projects going on in Kansas and across the country that are connected to food access and food as medicine. So probably many of you know what's going on in Kansas City with KC Fresh RX, but I think it's such an important project. I asked Donna if she would share with us a little bit more. She's going to tell you about it for 8 to 10 minutes. If you have more questions, catch up with her later. Then we're going to segue into our clinic panels. So thank you, Donna. Take it away.
Okay, thank you. 8 to 10 minutes, so I'll do my best. And I feel like I'm really connected with people here because I lived in Minnesota for a while, and my kids both live in Wisconsin, and go Badgers. I have one Badger alumni, and I also have a Boston alumni, so I feel like I've connected with folks this morning already geographically. So KC Fresh RX, it's a fruit and veggie produce prescription program that we're doing in Kansas City, and it's really targeted. I would call it like almost a pilot project that we really hope to kind of test and explore different things, and then our main really goal is to have it something that really can be done anywhere. So that's one of the things that I've learned talking with grantees from across the country that are doing produce prescription programs, that some of them really are so internal that it's hard to know how it could be expanded, but others are like looking for ways to really to in the future to how do we do this everywhere. The other thing I will add just very quickly is one of the things that we're really trying to do is connect two very complicated systems that seem to have lost connection, and those two systems are the healthcare system and the food system. They both do things really well, right? They both do things very well, but they often don't connect anymore. So that's really where we're coming from. So we have a 3-year grant from the U.S. Department of Agriculture. We've connected with 3 clinics in Kansas City, in the Kansas City area. They're both actually on both sides of the state line. We have one in Missouri and 2 in Kansas. One's like right on the state line. And we're actually thinking of adding a 4th family medicine one this coming year as a 4th clinic. They refer their patients to us that are Medicaid, that have Medicaid benefits, and they've experienced food insecurity in the last year, and they are pre-hypertensive or pre-diabetic. They are given an incentive that can be used at 25 grocery stores in the area. They receive in-person nutrition education with cooking demos and lots of good things given to them. And they also receive weekly text messages that give them more fun facts about cooking and food and reminders to use their incentive. So that's kind of the overview. Our goals are improvement of dietary health, particularly A1C and blood pressure, reduction of food insecurity, and then changes in healthcare use and associated costs. That would be reducing like ER visits, ED visits, reducing the number of visits that they're missing because of other things going on, reducing hospitalizations for diet-related issues, but also increasing some of the positive healthcare usage. So having a well-care visit, making sure that that's part of what's going on with you. Our grocery store-based incentive card that we've been using, some of you know from my introduction that I also am a project director from Double Up Food Bucks. So we really are building on that foundation of 8 years of Double Up Food Buck work. We have really strong grocery store partners, and so in the Kansas City area, one of our partners has 25 grocery stores. There are 4 different banners, and so they've been working with us and their point of sale system and their gift card, one of their gift card providers, to create a really innovative card that can actually be used at any of their stores. And it's exclusive to fresh fruits and vegetables, and it removes the sales tax. That's really complicated, by the way. So it's taken a lot longer than we had hoped, but we're there. So that's really exciting. So the amount of incentive we give them is by household size, $40 for each participant, another $20 a month for each additional household member. And they get that for 6 months, and then they can go shopping at any of those stores that's convenient to them. I won't do all of this, but we do a monthly nutrition classes in person. The first class that we do it has to be in person because that's where they get their card and they have to fill out all that lovely paperwork of, evaluation and things like that. And then 2 through 6 they have the opportunity to come in person if they're able to, or they can do it online through email or through a text message that we send their way. They receive recipe cards, cooking tools, handouts that provide them with a lot of different topics, including fun moving activities out in the community that are affordable. And then you can read all that, but all of our materials for this past cohort, which was our first cohort, have been translated into Spanish. And we also have one of our nutrition classes is completely interpreted in Spanish. So we do have that ability. We have 3 different locations, mostly related to the clinic sites, so that it's easy for them. If they can get to the clinic, we figure they can come to the class, right? And then one of those sites has both English and Spanish. So, program evaluation, we're looking at pre-post data. So the data that comes with them as a referred patient includes their blood pressure and A1C numbers. And then we do some evaluation to, screen for the amount of fresh fruits and vegetables they're eating, and a number of other things. And then we do it all again at the end of the 6 months as well. Let's see. We also have our clinics. We really try to reduce the amount of burden on our clinics because that's one of the messages that I've heard from almost every other produce prescription, that it's very burdensome, heavily burdensome on a lot of clinics, and they just don't have a lot of time, which we have actually very much observed. So, but we do need to have them look at their healthcare utilization, so that's one of their responsibilities. Yeah, and then we do a veggie meter reading too at mid program and at the end. So our first cohort was 2023. We had 22 actually that participated. We had wanted 60 participants, but since we were building it kind of as we were flying the plane at the beginning, we ended up with 22, which I was actually happy about. And amazingly, they all stayed with the program, which also is not terribly common with some of these programs. So at least the ones I've talked to. We issued 10,600 with incentives, and then redeemed almost 9,500 of that. And then you can see of the ones that we actually got the post readings for. We should have some pretty good numbers. 71% showed a reduction in A1C, 80% showed a reduction in the systolic blood pressure, and 50% showed a reduction in diastolic blood pressure. So we also had, similar to the Wisconsin model, they loved it. We really felt like people were very excited about this program. They liked talking about what they were doing and their successes, and so it was a really great, I feel like we had a really great cohort 1. And then cohort 2 is coming up starting in April. So we're hoping to kind of make up for some of the numbers that we weren't able to get in cohort 1 to really get to our overall. We hope to have at least 180 over the 3 years. So that's where we are.
All right. Well, thank you, Donna. A round of applause for KC Fresh. Again, if you have any questions on the program underway in Kansas City, please connect with Donna.